Hello, my name is Emily Blackburn and I am an instructor here at SUNY Brockport at the School of Nursing. Today I'm going to be going over a medication administration process. So here we have our patient, Mary Holmes, and she needs her morning meds. So number one, we need to do hand hygiene. Hand sanitizer is perfectly appropriate for this, or you can use soap and water. We're going to introduce ourselves. Hi Mary, my name is Emily. I'm going to be your nurse today. Include your role, whether it is the nurse or the student nurse. We also want to double check her name band, her wristband. So, two patient identifiers. Mary, can I have your name and date of birth? Mary Holmes, date of birth is 7/15. You are 40 years old. Wonderful. Next, we're going to assess for allergies. Mary, do you have any allergies? And we would want to pull up her chart and double check and make sure that those match up. No known drug allergies. Next, we are going to check the provider's orders and compare them to the medication administration record. So down at the bottom of our screen, we find our orders tab. We're going to double check our orders, specifically looking at the medications, and then hop over to the MAR, and make sure that those orders match up with the medications listed on the MAR. We are also going to review our lab values. So down at the bottom, double check our lab values, double check our eyes and O's, double check our vital signs, and any other pertinent information to the medications that we are going to be administering to the patient. Log into your MDS system and remove your medications. Compare your medication to your MAR. Log out of your MDS and your chart. Look up your medications as needed using your references and take your medication to your patient's bedside. Sanitize your hands as you are entering the room. Obtain your two patient identifiers and assess for allergies. Hi, Miss Mary, can you verify your name and date of birth for me, please? Mary Holmes, date of birth 7/15, you are 40 years old. And do you have any allergies? No allergies. Wonderful. We are going to bring up our MAR and scan our patient's wristband. At this point, I need to prepare the proper amount of medication to be administered using correct calculations while checking against the MAR. This will be my second check. So I'm going to verify that the information on the package matches the information on the MAR. I have metoprolol 25 milligrams and I need to administer 12.5 milligrams to my patient. So I need to split this pill. We're going to open the package and pop the tablet into my pill splitter. Making sure that the score line is straight so that the razor will split it in half. Half of this tablet will go into my pill cup and half will be disposed of. At this point, we need to educate the patient on medications as needed. This includes informing the patient of the drug names, the purpose, action, and potential side effects. Answer any questions that they may have. We need to scan and verify each medication. Click within the scan box, scan your QR code on your medication label, ensure that all of the information is correct, and then administer your medication to your patient via the correct route. We will now document date, time, and initials. So the date, the time, and initial, our administration, log out of our chart, and sanitize our hands. At this point, our medication administration is complete.